It's important to know that implants are never going to be as good as a natural tooth. An implant doesn't have the soft tissue. Your gums don't connect to an implant the same way that they do a normal tooth. So it's never going to look as nice as a normal tooth. You're always going to have deficiencies in the gums around the crown, and it's not going to be as comfortable. It's going to get food caught in there more than a natural tooth. It doesn't feel like a natural tooth. It doesn't have a ligament, so it doesn't have the natural cushion that your normal tooth does. And it doesn't look as good as a natural tooth. Implant dentistry has come a very long way, so we can get very close. And if you're missing your tooth already, it's the best option, if you can, to replace a tooth. And we can make it very comfortable, very aesthetic, very functional, but it will never be quite as good as a real tooth. And the reason I say this is because a lot of the times people think that, like, oh, I'm just having problems with my teeth, I should just get them all removed. Like, you really shouldn't. Like, it's not going to be the same. If you can save your tooth, you should. It's better to. Sometimes we'll have conversations with patients because they broke a tooth pretty severely, and they came to us because they were told somewhere else they needed an implant, so now they're coming us to get an implant. And a lot of the times we can save the tooth. So we always tell them, like, this is the best option. It's possible it breaks further down the line, and it's possible you need an implant sometime in your life on this tooth. But the longer you can prolong it, the better, because around an implant, you're going to have bone loss year over year. It's always going to happen. The rate of it can be, if it's a healthy implant, it's going to be very slow, but you will have bone loss, and implants don't last forever. So the longer you can save your natural tooth, even if you're going to eventually need an implant, the better. But in general, implants are screwed into the bone, and then they need to heal, and the bone actually fuses to the implant. So the screw structure of an implant, like it looks like a screw that you put into the wall. And that screw structure is only for initial stability. So it's only to make it tight in there for the first week. After that, after a couple of weeks, then the bone starts to fuse to it, and that's now what's holding the implant in. It's not the screw structure anymore. It's the bone that's been fused to the titanium. So usually it depends on the type of bone you have, the condition of your bone, but usually at about 3 months after you place an implant, it's going to be fully ready to work and have a crown and do everything. Sometimes you can do it faster. Sometimes it needs to be slower. It depends if you need, a bone grafting, sinus lifts, gum grafting, all sorts of things can be needed and can affect the time it takes. And then implants can be a single tooth. They can be a bridge. You can have 2 implants and a bunch of teeth connected to them. Implants can help your dentures. You can just have implants that snap onto your dentures, or you can have implants that are fully held by your denture. And so it's a full arch of teeth supported by your implants. We even use implants sometimes in orthodontics. So we have mini implants that are just there to hook elastics on to intrude your teeth or move your teeth in a specific way. So implant dentistry is a very full part of dentistry that's growing very, very rapidly. And the science is getting better and better every day for all of the surgery. The techniques are always improving, and it's another reason why you want to wait as long as possible, if you can, to get an implant, because an implant next year is always going to be better than an implant this year. So if you need an implant, if you're missing a tooth, find a good surgeon, because sometimes you need gum grafting and bone grafting for a better long-term result, both cosmetically and functionally. Amount of people that are told they need implants and don't actually need implants is surprisingly high. Find a dentist who's very conservative And always, if you're told you need an implant, always get a second opinion. It never hurts to get a second opinion. You can go back to your first dentist to get the implant if you need it, but always get a second opinion because you don't always need an implant when you're told that you do.